Hi everyone. My name is Kenneth Ngetich. I have a small video presentation for mental health need on special population in primary care. So first, I'll be dealing with the elderly or geriatric care for the mental health needs population. So it's an estimate of 20% of geriatric face mental health challenges. Mental health is a significant concern in population. The most common disorder affecting the geriatric uh, are anxiety, depression, cognitive impairment, and mood disorders. Suicide is a complication affecting the geriatric population. It affects mostly male than female. Geriatric men age 85 years old or older account for 45% overall geriatric suicide in the United States compared to the female counterparts. So the tools to diagnose the mental health issues in geriatric um, include DSM-5, which is Diagnostic and Statistical Manual for Mental Disorders. Um, it assesses tools used by healthcare professionals in the United States and worldwide as a standard to diagnose mental health. DSM-5 has description symptoms and other criteria for mental disorders diagnosis. It has established consistency and reliability in diagnosing patients. Pharmacological intervention, uh, this group, antidepressants are the first line treatment for the anxiety disorder. SSRIs and SNRIs are used in geriatric due to their tolerability and safety profile. Um, Citalopram is an approved drug mostly used to treat generalized anxiety disorder. It has demonstrated improvement in anxiety symptoms. Um, Paroxetine is also another drug widely prescribed in it's an SSRI with the most anticholinergic side effect, which lead to mucosal dryness, constipation, poor vision, retention, confusion in population. However, it has side effects such as weight gain. The next population are the perinatal or the lactation population. Um, Caring for the mental health for this population uh, is is important. Perinatal group, also known as the lactation population, is among the remarkable groups affected by the mental health disorders. Perinatal mental disorders are among the most typical uh, morbidity of pregnancy and makes an essential contribution to maternal mortality as well as to adverse neonatal infant and child outcome. It mainly centers around postpartum psychosis and depression with relatively little funded for research into patients' treatment, intervention in special service, and public health intervention. The tools that are used to screen and diagnose mental health issues in perinatal population uh, um, screening for women for maternal depression, improve outcome for women and infants. Maternal depression can be accurately identified using standard depression screening instrument. The earlier the women are identified with maternal depression, the earlier she receives treatment. All perinatal patients should be screened for symptoms of postpartum depression assisted with culturally appropriate regimens or referral to community resources. Um, Pharmacological intervention for this lactation uh, group, we have antidepressant drugs uh, among the best options for treating the postpartum depression. A combination of the depression and the depressants estrogen, individual psychotherapy, and possible group therapy is an effective regimen for perinatal um, mental health issues. There is no evidence adverse effects or consideration when using the antidepressants in lactating women. Antidepressants such as paroxetine, sertraline, and nortriptyline have not been found to have effects on infants. Pharmacological intervention is effective in treating women with postpartum depression. They positively impact the lives of mothers, their infants, and family members. The next special population are the pediatric or adolescents, caring for the mental health needs of pediatric population. Um, Pediatric mental health is an essential part of the children's overall health. It has a complex, interactive relationship with their physical health and ability um, to succeed in school, work, or society. Physical and mental health affect how we think, feel, act on the inside or outside. Mental health is essential throughout childhood, from perinatal consideration through the transition to adulthood. The pediatric population is entitled to happiness and a healthy life. The assessment tool to diagnose and mental health issues in pediatric. Columbia Depression Scale, the CDS screening tool, is among the tools that are used. Um, it's the Columbia Depression Scale, the DCS, is a 22 items self-report screening tool for um, adolescent and older for depression and suicide. The questionnaire focuses on feeling and behavior over the month. A high score of the screening tool indicates a high risk for mental health conditions such as depression or anxiety. There are similar instruments for the youth and parents. Adolescent Domain Screening Inventory is another tool. It's ADSI. The Adolescent Domain Screening Inventory ADSI consists of a 33-item alcohol and drug screening tool with 4 examined domains. The evaluation domain include community, family, individual, or peer, and school. Scoring indicates youth potential and high risk in each of the domain. And for the total scale, it is self-administered in about 10 minutes. So what are the pharmacological intervention for this specific uh, and the specific contraindication? The pediatric management, for instance, ADHD or ADD conditions, pharmacologically uh, is important through behavioral therapy. Adolescents with mental health concern must be first evaluated and assessed by a psychiatrist before and during the time adolescents are on pharmacological therapy. Latin is one of the common drugs used for ADHD and behavior. Adolescents' bodies react differently to drugs and sometimes in counterintuitive ways. Second, another group is LGBTQ plus caring for the mental health needs of this population. LGBTQ plus individuals are incredibly resilient and will thrive in the face of adversity with the help of supportive family, communities, and peers. LGBTQ plus individuals use mental health services twice as much as their heterosexual counterparts. They risk experiencing shame, fear, discrimination, and adverse and traumatic events when people identify themselves openly. They risk rejection from peers, family, and friends, exacerbating feelings of loneliness. Uh, the assessment tool for screening mental health issues in this special group um, is DSM-5. It provides an assessment framework of an individual mental health, especially regarding social cultural context and history. The other significant screening tool assessing LGBTQ Q plus individuals is CFI, which is called Performing or Cultural Formulation Interview. CFI examines the importance of culture on individuals' clinical presentation. It involves a set of 16 questionnaires used to obtain culturally relevant information during the mental health assessment. The four CFI identifiers domain of assessment include cultural definition of the problem, cultural perception of cause, context, support, cultural factors affecting self, coping, and past help seeking, and cultural factors affecting current um, help seeking. So, what are the pharmacological intervention and their contraindication? LGBTQ plus population are more likely than average to experience mental health their problems. LGBTQ plus individuals are at high risk of being diagnosed with depression, and the depressants provide relief and improve overall mental health. SSRIs and SNRIs are the frontline antidepressant drugs commonly used. SSRIs such as fluoxetine and citalopram are prescribed for 4 to 6 weeks. Antidepressant can cause longer-term side effects, but individuals to the individual, they vary in individuals with the drugs. Another special uh, group, immigrants or immigrant workers, caring for the mental health needs of immigrant population. Immigrant uh, process and migration process and individual arrive arrive in host country have greater impact on mental health. Various traumatic experiences, family separation, exposure to violence, lack of special support may lead to dysfunctional behavior. Uh, Act of consistently hiding current status and remaining hypervigilant, surrounding and changing the environment, age of migration and acculturation, loss of identity and decreased self-worth of self-esteem. The assessment tool to screen mental health issues in immigrants. Uh, Immigrants are affected by PTSD and mental health conditions requiring this population attention. DSM-5 is the main screening tool appropriate for screening the immigrants. The first diagnostic criteria for PTSD is experiencing a traumatic event. DSM-5 defines PTSD as an exposure to actual or threatened uh, death, severe injury, or sexually violent. The victims must experience symptoms in four clusters, including intrusion, avoidance, negative alteration in mood or cognitive, and alterations in arousal. The pharmacological intervention with the contraindication. SSRIs and SNRIs are common antidepressants used to treat PTSD in the affected immigration population. The recommended SSRIs and SNRIs for PTSD treatment include Zoloft, which is sertraline, uh, Paxil, fluoxetine, fluoxetine, this Prozac, Effexa are among the few antidepressant used for PTSD. The adverse effects of this medication include upset stomach, sweating, a headache, and dizziness, decreased sexual drive, and difficulty having awesome on is also one of the challenge. That's it. I hope you enjoy the video. Thank you.